Welcome to the Accent on Health Show. I'm Dr. David Bohn, and today we're going to talk about chronic low back pain. You know, most of us will experience back pain in our life. The statistics show that 9 out of 10 of us, actually about 84% of us, will experience a lifetime episode of back pain to a degree that will seek some type of health care for it. You have chronic back pain if you have pain that lasts for more than 12 weeks, or if you have chronic recurring episodes of acute back pain. Let's talk about statistics again. 28% of the population will have some prevalence or some episode of low back pain. 11% will have back pain so bad that it's disabling, really debilitating. And as I said, 84% of us will have a prevalence of low back pain in our lifetime, some episode that lasts long enough for us to seek care. Back pain is the #1 reason for alternative medicine. Not only for alternative medicine, but it's also the #1 reason that people visit their primary care physician. Unfortunately, many times they don't get the relief they need by seeking the traditional medical approach. But that's what we're programmed to do. From the time we're little, we look for natural solutions from our primary care physician because that's where we think we're going to get all types of health care. Unfortunately, family care is very poorly able to take care of most back pain episodes. 48% of people with back pain used alternative medicine or complementary medicine, and 30% saw an alternative or a complementary type provider, such as a chiropractor. Now, people also will find relief or use acupuncturist, massage therapy, home remedies. All these things play into the mix. But there's a lot of misconceptions out there. Probably the biggest misconception, and maybe even one that keeps you from seeking care, is that most chronic reoccurring back pain is due to some serious underlying condition. That's just not true. As a matter of fact, most chronic low back pain is not related to some serious underlying condition. Only about 1 to 2% of all chronic back pain patients have back pain because of a chronic condition. As a matter of fact, only 1 out of 100 back pain patients really benefit from surgery. That's really good news, people. Only 1 out of 100 people benefit from surgery. So why are all the people having surgery? I think it's because you just don't know that there's other options. That's why I'm doing this show, so that you can know that there's other options out there, other things available to help you deal with your chronic back pain. Let me talk about some red flags, things that should make you go, wow, something's really wrong here. If you have cancer or whether it's primary or metastatic cancer, if you have a tumor or an infection or a progressive neurological deficit, something that's a definite red flag, one of the statistical 1.4 to 2% of back pain cases, if you're one of those, you're going to have things like fever, night sweats, unexplained weight loss, pain that's there all the time, you can't escape it, and it's getting worse. Let me talk about some more misconceptions. People think that most back pain is caused by degenerative or bulging or herniated discs, or from spinal stenosis, or from something called spondylolisthesis, which is when a vertebra slides forward on the one above it, causing narrowing of the canal that houses the spinal cord. A few more facts. There's a high incidence of pathology in the asymptomatic population. There was a study about 5 to 7 years ago now where they took people who had never had back pain. No headaches, no mid-back pain, no low back pain, nothing even that they had gone to the doctor and mentioned. Matter of fact, they hadn't even treated it themselves. They were pain-free. These people were sent through an MRI scanner. They had a very detailed image taken of their low back. This study, this MRI image, revealed that 32% of these people should have back surgery. They had disc herniations large enough to warrant back surgery. Yet, they had no pain. They had never had pain. So there's a high incidence of people out there who have herniations, yet have no pain. My conclusion is these people have proven the fact that just because you have a disc herniation does not mean you have pain, and just because you have pain does not mean you have a disc herniation. So when you have a disc herniation, why rush into surgery right away? There's some other factors, like psychological factors, things that play into back pain, like your attitudes and beliefs about back pain. Maybe you have a fear or avoidance of seeking health care. Maybe you have a personality that you're responsible for everything. Maybe you have psychological distress, or maybe even a depressive syndrome or symptoms of depression, an illness-type behavior. These things can play into the back pain picture. Let's talk about how back pain develops. Well, usually there's an injury, and this starts pain. It could be an acute injury, a fall, a trauma, a car accident, a lifting injury at work, a lifting injury around the house, a slip and fall, something that causes injury to the tissue, and this produces pain. Most of the time, pain resolves on its own, just goes away. But sometimes pain begins to build. It starts a pain cycle, what I refer to as the back pain cycle. When you have pain that lasts for more than a few days, people begin to become anxious and worried, and that feeds their autonomic nervous system, their sympathetic nervous system. It becomes ramped up. This produces muscle spasm and tension that produces a lack of oxygen in the tissue, known as hypoxia, and this causes more inflammation, more swelling that produces more pain. So the cycle begins to go around, and the emotional stress ramps up the nervous system more muscle tension, more inflammation, more pain, until it's a huge problem and it becomes chronic and it's there all the time and it becomes a part of your life. I want to let you know that you don't have to live with chronic low back pain. There are very natural, non-surgical treatments available. Here at Accidental Health, that's what we specialize in. That's our forte. We specialize in non-surgical treatment of low back problems. Let's talk about some other things you can do to help with chronic low back pain, besides coming to see me. Usually it's included as part of our treatment. Education. Learn as much as you can about back pain. What works, what doesn't work. Look at the studies. When I say studies, I mean go to something like Medline or Medscape. Go to online search engines that take you to the medical literature and look at what's out there. The more you know about your back, the more likely you're going to have good outcomes. Manipulation has been shown and proven to be the #1 effective thing for chronic low back patients. If you have chronic low back pain, nothing beats manipulation. It wins hands down. Meditation, relaxation, aerobic exercise, great for back problems. Psychotherapy, if anxiety plays such a large part in your back pain, psychotherapy may help you learn to deal with the underlying issues that are causing your back pain. Education alone can help reduce anxiety and your fear of avoidance. It can promote you to an early return to activity, and it really empowers you as a patient. It allows you to understand what's happening. Education is a primary part of our treatment at Accidental Health. We want you to understand what's happening, why we're doing the treatments that we're doing, and what you need to know to do at home so that you can get the maximum response or the maximum benefit from our care. Chiropractic manipulation is really the #1 treatment at Accidental Health. I'm a chiropractor, so I specialize in manipulation. We call manipulation an adjustment. And what an adjustment does is attenuates the sympathetic part of your nervous system. It kind of turns down the hyperactivity and attenuates that sympathetic response. It turns down that part of the nervous system that's ramping up and causing this back pain cycle. It turns down the alpha motor neuron response. It turns down and releases the spasm. It allows the return of normal joint motion, and it reduces pain, and it returns normal muscle tone and normal muscle length. That's eliminating spasm. Now, one of the things that keep people from coming to see me is a concern of safety. It's because people have no real idea of what a chiropractor does. So they'll take over-the-counter medications, usually non-steroidal anti-inflammatory drugs known as NSAIDs. NSAIDs are things like Motrin, Tylenol, acetaminophen, which is Tylenol, ibuprofen, which is Motrin, aspirin. These non-steroidal drugs have serious risks. If you're taking these non-steroidal drugs, the risk of serious injury is 400 times greater with the medication compared to chiropractic. You're 400 times safer with chiropractic. If you're comparing the risk of death to the treatment with chiropractic, comparing medication to chiropractic, 160 times more likely to die taking the over-the-counter medications than you are with an adjustment. Chiropractic is incredibly safe. Chiropractic is also very effective and very efficient. There are 43 studies that I recently looked at for manipulation. Of these 43 studies comparing manipulation for low back pain versus other treatments, 30 of the 43 favored manipulation. 13 found manipulation or a chiropractic adjustment equal to or comparable to traction. Very good results in the literature. As I said, it's the #1 effective treatment for low back pain, manipulation. Meditation, well, you can do relaxation response. This reduces pain, anxiety, and muscle tension. Yoga is a very good way of meditating or centering yourself and learning how to relax muscles and stretch them out. Aerobic exercise, aerobic activity, walking. This is better than lumbar flexion exercises. Walking and movement increases movement in the lumbar spine and decreases pain and spasm. Specific back exercises for the low back were not effective. However, doing therapy ball exercises, the big round balls that you sit on, are very effective for low back pain because they develop your core muscles, which are what support and stabilize your lumbar spine. Staying active is the key. Dorland's Medical Dictionary says this: health is an optimal state, an optimal physical, mental, and state of social well-being. It's not merely the absence of disease and infirmities. Unfortunately, many of us base how healthy we are on how we feel, and it's really not that simple. How can you tell when you're at optimal health? There's no little gauge that goes off and shows you ill health versus optimal health. So where's the control center? What actually controls your level of health? If you look at Gray's Anatomy, which is the accepted authority on the human body, Gray says that the nervous system controls all the organs, all the systems, and all the cells of your body all the time. It's the control system, your nervous system. So here's the secret: having less stress. It's critical that messages are able to travel from your brain, down the spinal cord, out through the spinal openings, and reach all the systems of the body, free from interference. When this happens, you have health. Webster says health is when all of your organs are functioning at 100% all of the time. Unfortunately, most of us don't know when we're functioning even close to that. Here's the key: time plus function plus parts equals health. But you can't replace missing parts, can you? And you certainly can't turn back time. But chiropractic excels at improving function. By removing the factors that interfere with function, your health improves. Your overall feeling of wellness improves. Chiropractic excels at improving function. Stress causes malfunction and nerve interference. There's chemical, physical, and mental stress, and it all affects the body's ability to function at or near 100%. As a chiropractor, my focus is on how these interferences are affecting and changing the function of your nervous system. We call this a subluxation. It's an interference to the way your body's functioning. We look for and remove the spinal subluxations that could be causing the malfunctions that cause your back pain. How does chiropractic address low back pain specifically? It's a question I get all the time. First of all, I want to let you know that chiropractic doesn't cure your low back pain. Only your body can cure itself. It's key to understand that. If you have stitches in your hand, the stitches don't cause your skin to grow back together. They merely hold the skin together while your body heals. That's the only way you heal. Your body heals itself. Chiropractic, by removing interference from the nervous system, allows your body to function at a higher level of its optimal potential. You see, your body is a self-regulating, self-maintaining, and self-correcting organism. Chiropractic improves the quality of your life. I just want to let you know, if you're suffering, why not try it? There's so many studies out there, scientific and medical studies. One of them, published recently in the British Medical Journal, concluded this: long-term chiropractic care has a direct effect on the quality of life. Another one, published by Professor Splendori out of Italy, said that a most meaningful indicator of the effectiveness of chiropractic is the improvement it produces in the quality of life, not only because of its curative effect, but also thanks to its preventative and rehabilitative functions. As a chiropractor, I gently adjust the spine to restore function. Methods vary, and you may have tried some methods of chiropractic that just didn't give you the results that you needed. That doesn't mean all chiropractic is practiced the same. Chiropractic varies from a very light touch with a machine even through contact with the skin. I feel that you're going to benefit most from skin-to-skin contact, from actual manual manipulation where the joint moves, because we're trying to restore mechanical function. The intent of an adjustment is to remove the interference, let your nervous system function the way it's supposed to, so that your body can return to a level of optimal function effectively. How can you tell if stress is affecting the function of your nervous system? Well, there's tests we do in the office: posture analysis, physical examination, electrical examination, range of motion, many different studies to find out exactly how stress, physical and mechanical stress, is affecting your overall structure, alignment, and ultimately your function. Sometimes tests like MRI, X-ray, diagnostic imaging of other sorts is necessary to pinpoint the exact cause. If necessary, we'll refer you out for these tests to find out exactly what's causing your problem so that we can get to the cause and remove it. Well, how can you know if chiropractic is going to help? Well, I can tell you this, there's no way to know unless you see a chiropractor. You need to be evaluated to find out where your stress levels are. Where's the physical stress? Some people say, well, I asked my medical doctor whether I should see a chiropractor. You'll find more and more enlightened and knowledgeable medical doctors are referring their patients to chiropractors because they know the benefits and they've read the studies and they are up on the literature. Other medical doctors don't have as much knowledge or haven't taken the time to find out. But I'll tell you this much, asking a medical doctor who has no knowledge about modern chiropractic is like asking your Dodge dealer whether you should buy a Chevrolet. Of course you're going to be told, well, the Dodge is a better product. If you ask the Chevrolet dealer if you should buy a Dodge, he's going to tell you the Chevrolet dealer is better. In truth, you have more of a chance of being referred from a chiropractor to a medical doctor for a medical problem than you ever have of being referred from a medical doctor to a chiropractor. And I say that as a general rule because we have many physicians who refer their patients, when appropriate, to us for chiropractic treatment of their patients' mechanical low back pain. The best way to know if you can benefit from chiropractic care is to make an appointment today for a chiropractic examination. Chiropractic can help you experience a better quality of life. Why are you sitting at home suffering? Call us today to find out how you too can benefit from chiropractic care. Thanks for listening, and look for my radio show on WCBC every Saturday from 9 to 9:30, 1270 a.m. Keep the accent on your health. I'm Dr. David Bohn.
And it is not painful to have the treatment. I have not had any treatment that has hurt me. They have all helped me. So I would suggest anybody that has pain, regardless of what it is, they ought to come see Dr. Bohn.
When I first came here, I was so scared. But I had such lower and upper back pain, neck pain, that I couldn't even stand 5 minutes and do my dishes that I didn't have to go sit down. And I cried, it hurt so bad. Now I'm 73 years old and I feel like I'm 43. I feel like I can do anything. I don't hurt anywhere anymore. I couldn't work, and I couldn't go outside and work in the yard before. I couldn't. Now I can pick up big rocks and everything. I really can. I love it. I wish I could come here every day. I would recommend Dr. Bohn anytime. I've already recommended him to a few people that are coming, and I just love it here.